Hey everyone, welcome back to Orange Tree, where we break down real beauty solutions. If you are a woman and you are facing hair loss, you are not alone. Millions of women all around the world face this problem. Around 40% of women beyond 40 years of age face hair related issues. Today we are going to discuss about female hair loss. And did you know that hair transplants aren't just for men? They are very much popular in female as well. Out of every 5 patients we operate, there will be 1 patient who is a female, and therefore 20% of our hair transplant is being done for females. Today we are diving deep into female hair transplant, what they are, who they are for, the cost and the procedure itself, and at the end we will follow it up with tips and question and answers. Let's start with the basics of female hair loss. As you know, as I've already told you, female hair loss is quite common and significant number of females are affected with hair loss problem. What are the basic causes? Hormones contribute to most of the important causes of hair loss. Postpartum hair loss, menopausal hair loss, then PCOS also contributes significantly to hair loss. We have other hormone related issues like thyroid disorders, drugs having used for contraceptions, drugs used for chemotherapy. You have stress, which is also contributing to a significant number of hair loss, and that generally manifests like as a telogen effluvium. Also, there is another entity known as traction alopecia, traction in the terms of tying the hair very tightly, making ponytails, that also contributes to hair loss. Above all, genetics also contribute to the female pattern hair loss. The hair loss that we see in females generally starts from the center of the forehead, then it distributes around in a centripetal distribution. But a few hair transplant candidates will also be coming with a higher forehead or a receding hairline, and very few will be in the group like postburn alopecia or a small bald patch here and there. So these are the common situations that we encounter in our clinic with female hair transplant coming for the procedure. The good news is that in hair loss patients, the treatment is there, it's treatable. So what treatment we have in early hair loss? We generally have hair supplements, which is a cocktail of different kind of supplements that you can have a deficiency in your body. We have a lot of topical solutions which stimulates the hair follicles, and then we have some growth factors, mainly in PRP or GFC, which can be used as a therapy to enhance your hair growth. But when all of this method fails, then hair transplant is the treatment of choice, which is permanent and is everlasting. What is a female hair transplant? In female hair transplant, what we do is take out the hair follicles from a healthy donor area, which is mainly from the back of this scalp and from the side of your scalp. And this zone of hair is permanent and is DHT resistant. That means the testosterone hormone, which is generally affecting your hair loss, is not affecting these zones, and therefore these hairs are permanent, and these hairs after extraction they are put back to the thinned area or receding hairline area, and therefore this hairs remains with you and they give a permanent solution to your problem. Now, the transplant that you have is broadly into 2 categories, that is FUE and FUT, but we generally do FUE in females. That contributes the bulk of the hair transplant because FUE doesn't need any cutting and it's a minimally invasive procedure. What we do, we shave a small strip of scalp hair in the back, and from that strip of scalp area we take out adequate number of grafts, and these grafts are then put in the thinned area or bald receding areas. We don't need to shave your scalp, and you are perfectly normal in look before and after the surgery. What you end up is having a little shaved area in the back, which is generally hidden by the hairs which is in top and in the side. So your back also looks absolutely normal. But even if you don't want any shaving of your scalp, we do have another solution, that's a long hair transplant, where we don't shave any scalp, we just take out the hair in toto, keeping the length intact, and then these hair follicles are transplanted back with long hairs, and therefore they do look almost normal as if you have not got any hair transplant. So we have both shave technique and non-shave technique. Shave technique we can do good number of grafts. In non-shave technique we can do a limited number of grafts because of the limitation of time that it takes to do the procedure. Now, going deep into the procedure details, we do direct hair transplant, and that means we don't waste much time from extraction to implantation. And at the start of the procedure, we do a diligent hairline marking, making it artistic, fine, with a softness to the hairline, unlike in a male where the temples are strong, but in female the temples are blunted and the hairlines is very finely done so that it looks very natural. The surgery is done in a local anesthesia, the pain is almost negligible, and we also use a little sedation to make the pain almost disappear. Along with this local anesthesia, we also give you little IV analgesia so that your pain control is much better. The procedure generally takes around 4 to 8 hours depending on the number of grafts that we do, and after the procedure your hair looks almost normal, especially the back also is hidden with hair. So you have a small dressing which is generally taken off on day 2. For all of you who are looking for hair transplant solution, this professional tip is very important. You should search your surgeon and you should do a due diligence in your surgeon selection, mainly in terms of the certification that he has. He should be board certified plastic surgeon or dermatologist with immense training in surgery, especially fine tissue handling and surgical expertise. Surgical expertise is so important that it cannot be sidelined. Your fine tissue handling means we have to use fine instrument holding the follicles and using the instrument, so any kind of trauma will actually damage the follicle. Therefore, result will be much lower than what is desired. So your selection of your surgeon or hair transplant surgeon has to be accurate. You should also see that he has done enough number of hair transplant procedures so that the artistic design and thinking and the knowledge is adequate and you get the best result from your selected surgeon. Who is a good candidate? Not every patient needs this procedure. Ideal candidates are whose hair loss is stabilized, who has a nice decent donor area, mainly the back of the scalp and the side where the density is good, and thirdly whose expectation is realistic. You should avoid hair transplant in case you are pregnant, you are having skin related issues like psoriasis, or you are having uncontrolled medical illnesses, and if you are a chronic smoker with other coagulopathies. So this sets of population should not go for hair transplant as it will not be beneficial or it will backfire in terms of morbidity. Let's complete the course from A to Z. You come for the consultation, we discuss the issues, we plan the number of graft required, we plan the hairline. Then you come on the day of the surgery, we take the pictures, we take the consent, then you are wheeled into the surgical theatre where we give anesthesia, we do the procedure, and then we do a little bandage. You come out of the anesthesia in the room, post-op recovery room, you stay there for around half an hour to 1 hour. Then you go back home with the advice that you keep yourself elevated, you spray saline on the scalp where we have grafted, and you take the painkillers and antibiotics that we have advised. You come for the scalp wash on day 2 and day 6 to remove the scabs, to clean up the scalp. Then you are advised to continue some topical solutions on the scalp for it to have a boost in the hair growth, and by 3 to 6 months hair starts growing slowly, and by 12 months onward you have a full blown hairs which are looking very dense and thick. First 3 months you have to be a little patient as the hair is taking its blood supply and therefore the growth wouldn't have started much. So you should be a little patient in the first 3 months. 3 months, 4th month onward your growth is gradually happening and you get the best result by 1 year. That's very important. Coming to the cost of the hair transplant, the cost starts from 90,000 onward and starts from $1,000 otherwise, and the maintenance is very simple. You have to keep your scalp clean and apply certain topical solutions that has been advised by the clinic. Also you have to take supplements to get the best environment for the hair to grow. The common myth that is there, what we see around is most of the people think hair transplant is only for men. No, it's not. Around 20% of our patients who are coming for hair transplant are females. Therefore, it's quite popular in female and quite acceptable in females. Secondly, many ladies feel that hair transplant is fake, it doesn't look natural. Not at all. We have been doing hair transplant and we have been consistently giving a very natural soft hairline with a blunted temples which is very gentle, and it looks like a normal female hairline, and it will be very difficult for someone to differentiate between a transplanted hair and a non-transplanted hair. Thirdly, many people feel that this is very painful. Not at all. It's just like going for a dental treatment. It's just a small little stinging sensation of the injections. The procedure is totally painless. Along with that, we also give a little sedation to make it further pain-free, and you feel almost like having done the procedure without having the feel of a surgery. It's just the little stinging sensation which is transient, just 30 seconds to 60 seconds in the initial part of the procedure which hurts, then later on the whole procedure is painless. So all the 3 myths that you have has to be thrown in the dustbin. You should select the hair transplant as the best alternative for permanent hair loss solution. Female hair transplant can restore your confidence or crown. It's empowering. Write down your hair loss story in the comment section below. Please press the like button and subscribe, and stay tuned in for our future videos. Till then, bye bye.